Minister, thank you for that answer. Residents in my constituency will be extremely concerned by the news of the major COVID-19 outbreak at the Royal Glamorgan Hospital, which has sadly led to the death of 8 patients with a further 6 in intensive care, Minister. I'd like to express my sadness and shock at this news, but of course our thoughts are right now with their families. I met with the Health Board Chair today and support the action being taken by the Health Board to ensure this outbreak is fully contained. Minister, could you update me on the latest position from a Welsh Government perspective? In particular, can you give details of the support being provided by the Welsh Government to help control the outbreak? Could you also provide any details of the implications for those who have had operations postponed? And finally, Minister, I'd be grateful for a general update on how the local lockdown in Rhondda Cynon Taf is progressing in respect of infection rates, and with the Royal Glamorgan outbreak in mind, do you see a need for further testing resource to be targeted on RCT?
Thank you for that series of questions. In terms of the action that the Health Board are taking, my understanding is they had a meeting with local partners, crucially the local authority, yesterday, where they discussed and agreed the range of measures being taken. And I do think it is a sensible safety precaution to minimise routine care when they are experiencing an outbreak of infection. That does mean that people will have procedures delayed and rescheduled at a later date, but that is in the best interest of those patients. Not to admit them onto a site for routine procedures where we understand there is an outbreak where harm is being caused. And that is a temporary measure while the outbreak is being brought under control. At this point in time, the Chief Executive of NHS Wales is in regular contact with the Health Board to have a proper understanding of the measures that are being taken and the oversight, as indicated earlier, for the measures and the control measures to understand what is happening with both the staff testing that's in place, to understand if there's a need to do more as a result of the staff test results we get, to see where the outbreak actually is and to see how well contained it is. So we're learning and applying the measures from the Wrexham Milo. I think in terms of your broader point about measures within the community, I think it's important to reflect that whilst we haven't seen the same reduction in cases that we have seen, fortunately, in Caerphilly and Newport also making good progress, there is some cautious evidence to think that we may be seeing a plateau. It's still at a very high level, but we'll want to understand if that really is the case, and that will give us some further hope for the future. But the evidence of Caerphilly is that it is possible to see a reduction in rates and that this is not a one-way escalator to further and further restrictions. We'll continue to measure and weigh whether there is a need to do more to help control the spread of the virus across the RCT area. I think the key point is that it's in the hands of people in their communities to look after each other, and the rules are there for the benefit of everyone. And if we get a high level of adherence to that, then we can expect to see a reduction in the spread of coronavirus and the harm that we know it has already caused and is likely to cause. We'll continue to review matters on a regular basis. That includes a provision of testing services. We've actually seen a fall in the number of people taking up the testing services available. So the concern that the Health Board have is not that we don't have enough access to testing, but that actually there are people who should be getting a test who are not. So again, it's an appeal for people to use the testing resources that are available within RCT, and we'll continue to do how and where they're provided to make sure they're readily accessible for all the communities that need to access them.